Before irrigating a wound, check to see what kind of solution the provider has specified in the order. Then gather your supplies. Perform hand hygiene and ensure privacy. Introduce yourself to the patient and identify her using 2 identifiers.
Hi, my name is Rachel and I'll be your nurse today. Can you give me your name and your birthday?
Betty Arnett, 10/15/55.
Okay, I'm going to look at your wound today. Okay. I'm going to log on and look at your last wound assessment.
Bacteria and debris can be removed from a surgical or chronic wound by flushing it with water or a cleansing solution. Assess the wound before you begin the irrigation.
I'm going to be palpating the edges.
Wear a gown and goggles to protect yourself from any splashes or spray. Start by immersing a container of the cleansing solution or other irrigant in a basin of hot water to warm it to body temperature. Help the patient into a position perpendicular to the collection basin to allow the irrigation solution to flow into it. Protect the bedding by slipping a waterproof pad or extra towel under the patient. The patient's bedding and gown should be adjusted to expose only the wound. Open the irrigation kit and apply sterile gloves. The irrigation procedure is a little different depending on the size and depth of the wound. To irrigate a wound with a wide opening, fill the syringe with the prescribed irrigating solution. Attach a sterile 19-gauge angiocatheter or a 19-gauge needle to the syringe. Set the collection basin on the pad. Hold the tip of the syringe 1 inch above the upper end of the wound and flush it using steady pressure. Continue to refill the syringe and flush the wound until the solution draining into the collection basin is clear. To irrigate a deep wound, use an already prepared catheter syringe or attach a catheter to a filled irrigating syringe. Gently insert the tip of the catheter into the opening of the wound to a depth of 1/2 inch or about 1 centimeter. Flush the wound using slow, continuous pressure. Move the syringe around, being sure to irrigate all parts of the wound. Refill the syringe if necessary. As with a shallow wound, you'll continue until the solution from the wound is clear. To irrigate a wound with a handheld shower, seat the patient comfortably in a shower chair. Adjust the spray to a gentle flow. Make sure the water is warm, but not too hot. Spray the wound for 5 to 10 minutes, holding the shower head 12 inches or about 30 centimeters from the wound. If the provider has ordered a culture, obtain it after you've cleaned the wound. Dry the edges of the wound with gauze. Apply the appropriate dressing. Label it with the date and time and initial it. Now remove your personal protective equipment.
Are you comfortable? Is this position okay?
Yes.
Okay.
Dispose of your used supplies. Perform hand hygiene. As part of your follow-up care, inspect the dressing periodically according to your agency's policy.